Welcome to the Banish Cancer Podcast. I'm Rachel, and today we're talking about a breakthrough that's giving real hope to people facing one of the toughest forms of multiple myeloma, extramedullary disease. If you've ever been told your options are limited, this episode is for you. Joining me is our cancer wellness educator, James. James, thanks for being here.
Thanks, Rachel. Extramedullary multiple myeloma is one of the most aggressive forms of the disease, and it often stops responding to standard treatments. That's why the progress we're seeing with dual antibody immunotherapy is so important.
Let's start with the basics. What exactly is dual antibody immunotherapy?
It's a treatment that uses two engineered antibodies at the same time, usually talquetamab and teclistamab. Each antibody targets a different marker on myeloma cells and also engages T cells. By activating two immune pathways at once, the therapy helps the immune system find and attack cancer cells more effectively, even when the disease has spread outside the bone marrow.
So it's like giving the immune system two different ways to lock onto the cancer.
Exactly. And that dual target approach is why we're seeing stronger responses than with single antibody treatments.
Speaking of responses, what have the results looked like so far?
Very encouraging. In one major study, about 79% of patients responded to treatment, and more than half had no detectable disease afterward. For extramedullary myeloma, which is notoriously hard to treat, that's a major step forward. The median duration of response was around 13.8 months, meaning many patients had more than a year of disease control.
For people who have already been through multiple treatments, that's a big deal.
It really is. These patients had already received therapies like proteasome inhibitors, immunomodulators, and anti-CD38 antibodies. So seeing such strong responses in a heavily pretreated group is impressive.
One thing that stood out to me is that this therapy is off the shelf. What does that mean for patients?
It means you can start treatment right away. Unlike CAR T therapy, which requires collecting and engineering your own cells, a process that takes weeks, dual antibody immunotherapy is ready to use. For aggressive disease, that speed matters.
How does it compare to CAR T in terms of safety?
CRT can cause severe cytokine release syndrome and neurological side effects. Dual antibody therapies can still cause CRS, but it's usually milder. Patients may experience fever, fatigue, low white blood cell counts, infections, or skin and nail changes. But overall, the rate of severe reactions is lower, and doctors are now very experienced at managing these side effects.
So supportive care is a big part of making this treatment work.
Absolutely. Preventing infections, boosting blood counts, staying up to date with vaccines, all of that helps patients stay on therapy and maintain quality of life.
Before we wrap up, what's the main message you want listeners to take away?
Hope. Extramedullary multiple myeloma used to mean very few options and short remissions. Dual antibody immunotherapy is changing that. We're seeing high response rates, deeper remissions, and longer control, even after many prior treatments. It's not a cure, but it's meaningful progress, and more trials are underway.
That's powerful. James, thank you so much for joining us.
Thank you, Rachel.
This has been the Banish Cancer Podcast. If this episode helped you, share it with someone who needs hope today. When we learn together, we grow stronger.